April is Alcohol Awareness Month, which is a time to shed light on alcohol use and the barriers that keep people from getting help. New research from Harris Poll finds nearly half of those with alcohol use disorder aren't getting diagnosed until a crisis. And so joining us now this morning is Dr. Joseph Volpicelli with the Institute of Addiction Medicine. Thank you so much for joining us this morning.
Thank you for having me.
All right, so this is such an important topic. It affects so many people. Let's first start off with do you define alcohol use disorder, and how is it different from what people might consider heavy drinking?
Yeah, so the primary concern is if a person starts drinking, do they have trouble controlling how much they drink? So people who have an alcohol problem, the active drinking actually creates the craving to have the next drink. And over time, this impaired control can lead to a variety of physical, behavioral, and psychological problems.
All right, and let's talk about, the people that are affected. One of the statistics that kind of stands out to me is that 47% of people aren't diagnosed until a crisis. Why do you feel like so many cases are unnoticed for, longer periods of time?
Yeah, we can do a much better job of diagnosing the problem early and getting people help before it becomes a large problem. I think the biggest issue is that people often have a lot of shame associated with their drinking and feel guilty. So they don't talk to people. They don't talk to their healthcare provider about the issue. Then the other problem is I think healthcare providers need to do a better job of bringing the topic up. There are simple screening instruments that we can use to help assess if someone is drinking is a problem. And they're good, effective treatments, particularly if you intervene early.
Dr. Volpicelli, I know you mentioned stigma. Obviously, it's a big topic. For those, at home wondering, has this gone too far? Is this really an addiction? What would you say? What are some things they need to look out for, meaning that I need help?
Yeah, so it's important to see what consequences is occurring around the drinking. So for some people, when they drink, they believe it helps to reduce anxiety, but they find the next day their anxiety is even higher than it was before. So people will report that they have hangovers at work, or there's impaired social relationships. The person's just not around anymore. And it's really important to keep in mind that we need to approach this with compassion and empathy, not with blaming. That people often feel guilty and shameful enough that it's important not to add to that, but to do your research, understand about the science of addiction, and help give people good, effective options.
All right, some great insight you shared with us this morning. Thank you so much, Dr. Joseph Volpicelli, for staying with us.